Alzheimer's prevention, early signs and solutions. Alzheimer's disease is a neurodegenerative disorder that gradually destroys brain cells, leading to a decline in memory, thinking, and behavior. It is one of the most common and serious conditions affecting older adults, not only disrupting the lives of the individuals diagnosed, but also impacting their families and loved ones. Alzheimer's typically develops slowly, and its early symptoms are often subtle and mistaken for normal age-related changes, making it easy to overlook or misdiagnose. However, identifying early signs of Alzheimer's disease is crucial because it allows for timely diagnosis and intervention. While there is currently no cure for Alzheimer's, early intervention can help maintain cognitive function for a longer period and reduce the negative effects of the disease. Recognizing these early signs can significantly improve the quality of life for the patient and help families prepare mentally and emotionally for the challenges ahead. Although current treatments primarily focus on alleviating symptoms and slowing the disease's progression, early intervention through proper nutrition, physical activity, and cognitive support can make a significant difference. Furthermore, changes in daily habits and living environments also play a vital role in reducing the risk of developing Alzheimer's. The goal of this article is to raise awareness about Alzheimer's disease by providing information on early signs of the disease, intervention methods to slow its progression, and effective prevention strategies. Additionally, the article will feature an interview with a specialist doctor to offer deeper insights into what we can do to protect ourselves and our loved ones from Alzheimer's disease. 1. Short-term memory loss. One of the most noticeable and common signs of Alzheimer's disease is short-term memory loss. Short-term memory refers to the ability to retain and recall new information for a short period, such as remembering the name of someone you've just met, recalling recent events, or remembering a scheduled appointment. However, in people with Alzheimer's, short-term memory begins to decline significantly, leading to difficulty remembering recent events or important details in daily life. Short-term memory loss is not uncommon in the elderly, but when it starts to affect the ability to remember recent conversations, appointments, or daily tasks, it may be a sign of Alzheimer's disease. People with Alzheimer's often forget what they talked about just moments ago and may repeatedly ask the same question, which can cause confusion and frustration for the individual. Another distinct sign is the person forgetting the names of loved ones or important events in their life, even though they may still recall memories and events from the distant past. This happens because Alzheimer's damages the brain regions responsible for storing and retrieving short-term memories. People with Alzheimer's may experience situations where they cannot remember what happened earlier in the day, or cannot find items they frequently use, such as keys, phones, or glasses. This creates a sense of anxiety and confusion as they become aware of the cognitive decline taking place. This sign can progress over time, making it increasingly difficult for the person to complete simple tasks, such as remembering the name of a friend or recalling a recent event. Recognizing these early signs is essential so that medical intervention can take place promptly. Early detection allows for cognitive support methods to slow down the disease's progression and help manage symptoms. 2. Difficulty performing familiar tasks. Another clear sign of Alzheimer's is difficulty performing familiar tasks. Before the onset of the disease, individuals can easily complete daily tasks such as cooking, driving, or answering the phone. However, as the disease progresses, patients start to struggle with tasks that were once second nature to them. A typical sign of Alzheimer's is when the person can no longer remember the steps involved in cooking, or they forget essential items required to complete tasks. They may start to make mistakes during routine activities, or fail to complete tasks properly. For instance, in cooking, they may forget to heat the pan or add spices at the right time. These small errors can complicate the task and make it more difficult for the person. Additionally, Alzheimer's patients may experience difficulty with driving. They may not recognize familiar roads or find themselves lost even when driving in areas they have lived in for years. This happens because Alzheimer's affects the spatial and temporal memory, making it difficult to recall surrounding landmarks or follow directions accurately. Simple tasks in daily life, such as dressing, personal hygiene, or organizing items around the house, can also become a struggle. The person may forget how to wear appropriate clothing for the weather, or may no longer be able to distinguish between clean and dirty clothes. This can lead to feelings of embarrassment, frustration, and dependency on others for daily care. These changes not only affect the person's ability to care for themselves, but also cause anxiety and stress as they become aware of their struggles. To reduce the impact of these changes, creating a supportive environment and providing assistance with daily routines is crucial. Cognitive support activities such as memory exercises, task management tools, and structured routines can help maintain certain abilities. 3. Getting lost and disorientation. Another striking symptom of Alzheimer's is the tendency to become lost and disoriented, especially in familiar surroundings. In the early stages of the disease, individuals may begin to feel lost in environments they've known for years, such as their own home or neighborhood. Alzheimer's affects the brain's spatial awareness, preventing the person from recalling familiar places or pathways. This can lead to the individual becoming lost in familiar environments, causing feelings of anxiety and distress. For example, the person may forget how to return home despite having lived there for many years, or they may fail to recognize streets and locations that they've passed countless times before. In addition to becoming disoriented in physical space, Alzheimer's can also cause the person to lose track of time. They may forget what day it is, which season it is, or even the year. This loss of temporal orientation can make it challenging for the person to manage daily activities or appointments, as they are unable to properly organize their schedule. The loss of direction in space and time can lead to wandering behaviors, where individuals may leave home and not know how to return. This can present serious risks to their safety, especially if they are in unfamiliar environments or cannot recognize dangers like traffic. It is essential for caregivers to monitor these behaviors closely and ensure the safety of the person. To help mitigate the effects of disorientation, creating a stable, structured environment and using visual cues, such as clear labels and signs around the home, can aid in memory retention. Moreover, caregivers should remain vigilant and offer assistance when needed, ensuring that the person is not left alone in situations where they might become lost. 4. Mood and behavior changes. One of the hallmark symptoms of Alzheimer's is significant mood and behavior changes. These changes can happen early on in the disease and have a profound impact on the patient's daily life, as well as on their relationships with family members and caregivers. Alzheimer's affects the parts of the brain that control emotions and behavior, which leads to increased irritability, mood swings, and unusual behavior. A person with Alzheimer's may become irritable or upset over things that they would have previously handled calmly. They may respond disproportionately to minor frustrations or become easily annoyed. Such behaviors are often confusing for family members, who may not understand why the individual is reacting this way. Another common emotional response is depression. Many Alzheimer's patients experience feelings of sadness or a sense of loss, especially as they realize their cognitive abilities are declining. They may withdraw from social activities, lose interest in things they once enjoyed, or isolate themselves. This depressive state can be exacerbated by the person's growing inability to care for themselves or maintain relationships. In addition to irritability and depression, people with Alzheimer's may exhibit paranoia or suspicion. They might begin to distrust their family members or caregivers, accusing them of stealing or lying, even when there is no reason for such suspicions. This is due to the disease's impact on memory and the ability to reason logically. Behavioral changes can also include increased agitation, restlessness, or even aggressive behavior. Individuals may experience outbursts of anger or frustration, sometimes for no clear reason. These changes are often challenging for caregivers to manage and can lead to feelings of stress or helplessness. To cope with mood and behavior changes, caregivers should create a calm, structured environment. It's also important to offer reassurance, avoid confrontation, and ensure the person's comfort and safety. Engaging the person in familiar activities, providing emotional support, and maintaining consistent routines can also help manage emotional fluctuations. 5. Decreased communication skills. Decreased communication skills are one of the most noticeable signs of Alzheimer's disease. As the disease progresses, individuals often struggle to find the right words, follow conversations, or express themselves clearly. This decline in verbal communication can lead to frustration for both the person with Alzheimer's and their family members. One of the earliest signs of communication difficulty is forgetting words or losing track of thoughts during conversations. The individual may stop mid-sentence, unable to recall what they were going to say next, or they may struggle to find the right words to describe things. This can make interactions feel awkward and increase the individual's feelings of embarrassment. Another common symptom is repeating the same question multiple times. Due to memory loss, the person may forget that they've asked the question earlier, leading them to repeat it over and over again. This can be frustrating for both the person with Alzheimer's and their caregivers, who may not always know how to respond in a way that is reassuring. As the disease progresses, people with Alzheimer's may experience difficulties in understanding complex language or following conversations. They may struggle to process what is being said to them, especially if the conversation involves multiple topics or requires reasoning. This makes it harder for the person to participate in social interactions and can lead to withdrawal from conversations altogether. In the later stages of Alzheimer's, the individual may become completely nonverbal or unable to communicate effectively at all. This loss of verbal communication can be one of the most challenging aspects of the disease, as it further isolates the person from their loved ones and prevents them from expressing their needs or feelings. To assist with communication, caregivers can use simple, clear language and offer ample time for the person to respond. Using visual aids, gestures, and facial expressions can also help bridge the communication gap. Most importantly, caregivers should be patient, understanding, and supportive, offering comfort and reassurance when verbal communication becomes difficult. Early intervention methods. Alzheimer's disease is currently incurable, but early intervention can help slow the progression of the disease and improve the quality of life for patients. Early detection and the application of appropriate intervention methods are crucial to alleviating the burden on both patients and their families. Below are the key early intervention methods for treating Alzheimer's disease. 1. Early diagnosis. Early diagnosis of Alzheimer's disease is crucial for managing the progression of the condition. When Alzheimer's is diagnosed at an early stage, treatments can be initiated promptly, helping to slow cognitive decline and minimize the severe effects of the disease. Why is early diagnosis important? When Alzheimer's is detected early, appropriate treatments can be started immediately, which helps to slow the disease's progression. If left untreated, brain cells will continue to deteriorate, making the disease harder to control. Early diagnosis opens up opportunities to use medication and cognitive support therapies, which can reduce symptoms and help maintain cognitive functions over time. Diagnosis process. Diagnosing Alzheimer's typically begins with a comprehensive health examination and various tests to assess memory, thinking, and other cognitive functions. Imaging tests like MRI, magnetic resonance imaging, or CT scans, computed tomography, can help identify damage to the brain. Doctors may also request blood tests or genetic tests to rule out other conditions that could cause memory loss. Signs for early diagnosis. Short-term memory loss, especially forgetting recent events. Difficulty performing routine tasks. Disorientation and getting lost in familiar environments. Mood and behavioral changes. Early detection helps create the opportunity for starting treatment right away, which can improve the quality of life and slow the progression of the disease. 2. Medication treatment. Currently, there is no cure for Alzheimer's disease, but medications can help reduce symptoms, control progression, and improve the quality of life for those affected. Proper medication use can help maintain cognitive function and reduce behavioral and mood-related symptoms. Types of medications used for Alzheimer's. Donepezil. Aricept. This is a widely used medication for treating Alzheimer's symptoms. Donepezil helps increase the levels of acetylcholine, a neurotransmitter crucial for memory and cognitive function. Memantine. Namenda. This drug is used for moderate to severe Alzheimer's. Memantine helps regulate the effects of glutamate, a chemical in the brain, which reduces cognitive decline and improves daily functioning. Rivastigmine. Exelon. Similar to donepezil, rivastigmine is used to boost acetylcholine levels in the brain, which helps improve memory and cognitive abilities. Galantamine. Razidine. This medication also works similarly to donepezil and rivastigmine, increasing acetylcholine levels to improve memory and cognitive function. Benefits and effectiveness of medications. Alzheimer's medications primarily help reduce symptoms such as memory loss, disorientation, and communication difficulties. While these medications cannot cure the disease, they can help slow the progression of symptoms, particularly in the early and middle stages of Alzheimer's. Side effects of medications. Although these medications can help improve symptoms, they may also cause side effects such as nausea, fatigue, dizziness, or diarrhea. Therefore, medication use must be closely monitored by a healthcare provider, and dosage adjustments should be made based on the individual's condition. 3. Cognitive support therapies. In addition to medication treatment, cognitive support therapies play a crucial role in managing Alzheimer's disease. These therapies help patients maintain cognitive functions for a longer period and alleviate symptoms, improving their overall quality of life. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is an effective approach for helping patients improve problem-solving skills and reduce negative behaviors such as anxiety, depression, and irritability. CBT can help patients manage negative emotions and develop healthy habits to sustain cognitive function. By changing thought patterns and behaviors, this therapy supports emotional regulation and helps preserve a patient's independence. Memory exercises and cognitive skill training. Memory exercises and cognitive skills training are essential parts of cognitive support therapy. Alzheimer's patients can engage in activities such as playing board games, puzzles, or brain games to stimulate the brain, learning and memorizing simple songs or passages to improve short-term memory, using assistive tools like reminder notes, apps, and information cards to help patients remember daily tasks and important events. Additionally, creating a safe and recognizable environment for patients is part of cognitive support. Using signage, name tags, or organizing the living space in an easy-to-understand way can help reduce confusion and anxiety. Caregivers should also encourage patients to engage in familiar activities, providing emotional support and maintaining consistent routines. 4. Lifestyle adjustments. Lifestyle adjustments are an essential part of early intervention and treatment for Alzheimer's disease. A healthy lifestyle not only helps reduce risk factors, but also supports overall well-being and slows the progression of the disease. Healthy eating habits. Diet has a significant impact on brain health. Alzheimer's patients should follow a diet rich in antioxidants, fiber, and omega-3 fatty acids, found in foods like fish, berries, leafy greens, and nuts. The Mediterranean diet, which is rich in vegetables, olive oil, whole grains, and fatty fish, is highly recommended for improving brain health. It's important to limit sugar and processed foods, as these can increase the risk of developing Alzheimer's and negatively impact cognitive function. A balanced diet helps maintain overall health and supports brain function. Regular physical activity. Research shows that regular physical activity improves blood circulation and strengthens cognitive function. Activities like walking, swimming, yoga, or even light exercise can help reduce the risk of Alzheimer's and maintain cognitive function over time. Alzheimer's patients can start with gentle exercises and gradually increase the intensity as their health allows. Stress management and sleep. Chronic stress and lack of sleep can increase inflammation in the body, which may elevate the risk of Alzheimer's. Managing stress through practices such as meditation, yoga, or relaxation exercises is beneficial for reducing these risk factors. Additionally, adequate sleep, 7 to 8 hours per night, is crucial for overall health, allowing the body to rest and the brain to function optimally. Caregivers should encourage Alzheimer's patients to maintain a calm, consistent environment. Creating a structured daily routine and ensuring the person gets enough sleep and relaxation can make a significant difference in their overall well-being. Conclusion: Alzheimer's disease is a serious condition, but early intervention can slow its progression and improve the quality of life for those affected. Early diagnosis, medication treatment, cognitive support therapies, and lifestyle adjustments are all essential methods for managing Alzheimer's and reducing symptoms. These approaches not only help maintain cognitive function but also improve daily living and emotional well-being, making it possible for patients to live with Alzheimer's disease for longer, healthier, and more fulfilling lives. To gain a clearer understanding of Alzheimer's disease and early intervention methods, we interviewed Dr. Nguyen Minh Tuan, a neurologist specializing in Alzheimer's and neurological diseases in the elderly. Below are some insights from the doctor about early detection, treatment, and support for Alzheimer's patients. Interview with a specialist. Question, Doctor. Can you explain the importance of early detection of Alzheimer's disease? Dr. Nguyen Minh Tuan. Early detection of Alzheimer's disease is crucial because the disease develops gradually, and its symptoms may not be immediately obvious. If left undiagnosed, it can cause significant difficulties not only for the patients but also for their families and communities. When detected early, interventions can be started with medications and cognitive support therapies, which can help slow the progression of the disease and improve the quality of life. Early signs such as memory loss, getting lost, mood changes, and difficulty performing familiar tasks are all important indicators. Question: can you share more about the effective treatments and interventions for Alzheimer's disease? Dr. Nguyen Minh Tuan. Currently, while there is no cure for Alzheimer's, many treatment methods can help reduce symptoms and slow the disease's progression. The first method is medication. Drugs such as donepezil, rivastigmine, and memantine can improve memory and cognitive function, allowing patients to maintain their ability to perform daily tasks for a longer period. However, these medications only help alleviate symptoms. They do not reverse cognitive decline. In addition to medication, cognitive support therapies such as cognitive behavioral therapy, CBT, and memory exercises are crucial for maintaining cognitive functions and reducing anxiety, depression, and irritability. Activities like board games, reading, or engaging in intellectual games stimulate the brain and help maintain memory. Finally, lifestyle adjustments are essential in managing Alzheimer's. A healthy diet, regular physical activity, and a stable, comfortable living environment can help patients maintain independence for longer, reduce stress and depression, and improve overall health. Question: do you have any advice for families and caregivers of Alzheimer's patients? Dr. Nguyen Minh Tuan. The most important advice is that families and caregivers need to be patient, understanding, and provide the best support for the patient. Caring for someone with Alzheimer's requires persistence and compassion. Families should create a safe, familiar environment, avoid sudden changes in the living space to reduce anxiety and confusion for the patient. They also need to take care of themselves, as caring for an Alzheimer's patient can be exhausting and stressful, and when the family is physically and emotionally healthy, they can provide better care for the patient. Conclusion: Alzheimer's disease is one of the most serious neurological conditions affecting the elderly. Although it currently cannot be cured, early intervention is a key factor in slowing the disease's progression and improving the quality of life for those affected. Identifying early signs such as memory loss, difficulty performing daily tasks, getting lost, mood changes, and communication difficulties allows families and caregivers to take proactive steps in seeking support and treatment. Early diagnosis helps identify the disease at its onset when treatment methods can be most effective in improving the quality of life and slowing its progression. Medications currently available can help reduce symptoms and maintain cognitive function for a longer time, especially in the early and middle stages of Alzheimer's. In addition, cognitive support therapies and lifestyle adjustments are essential for improving daily living and emotional well-being, allowing patients to live more independently for longer periods. The most important thing is that caregivers need to be patient and empathetic, creating a safe, supportive, and stable environment for the patient. In addition, providing emotional support for Alzheimer's patients and giving them the opportunity to engage in cognitive and physical activities can reduce the negative impacts of the disease and enable patients to live longer, healthier, and happier lives. By recognizing early signs and intervening promptly, we can help Alzheimer's patients lead a better quality of life and reduce the burden on their families and society. From treatment methods to compassionate care from families and the community, all play a vital role in improving the health and lives of those affected by Alzheimer's. Finally, to grasp additional information about health or if you have any advice, do not hesitate to comment below the video as well as subscribe to the Radiant Health channel to help me, so that I have more motivation to release the next videos. Thank you very much, everyone.